Hey guys, it's Dr. Emer. We're middle of the day today, and I just wanted you to see something cool. Before we had very expensive treatments like things called Cellfina, and I do love you guys, Cellfina, you know, is one of the first doctors that used it, but we have a patient here just has some small problem areas of cellulitic indentations or dimples on the buttock, and we're using old school Subcision with something called a no-core needle. If you take a look, it looks really scary because it's a little razor blade on the end of a needle, and this goes underneath the skin. And this blade allows me to literally cut the bands. Now, it's not nearly as strong as a motorized needle, but when you only have a few spots, it's not really worth, you know, the $5,000 treatment or whatever it would be to do all these just few spots. So in the office, we numb the area, and we go right where those indentations are, and we go similar to what we would do with Cellfina. We go right under the surface, spreading, and you can see, look, when I'm pulling, look, the band is holding that cellulite down. So we have to work our way through that band by cutting it, all right? And with Cellfina, you do that motorized. Right now, I'm doing it by hand. So see, I'm doing a little windshield wiper technique, and look, now take a look. The band is cut, see? I'm moving through like a windshield wiper. And that allows me to, now it's not going to be as effective as a motorized needle, but because we're going to add a little bit of filler underneath, something called Bellafill that builds long-term collagen, the chance of this coming back is very minimal. So she's pretty much going to get a Cellfina-like result from an in-office small procedure with no pain. You can see, look, windshield wiper. That's the key. That's what you want. So that's treating small indentations. So let's go to the next step. Grab the Bellafill. And we're just going to use a syringe, a very small amount, to put a little bit of product under each area. So right where we just deposited, you know, did that subcision, we're going to put just a little bit of the Bellafill under there. And this allows us to build, create a barrier between the area that was being pulled down before, and so that the skin doesn't re-adhere. The other is so that it builds long-term collagen there and plumps up those indents. How much somebody needs is tough to say. I tell people to come back in about 6 weeks and we take a look, and if we need to build, we can build. But that's it, the main indentations and the subcision for in-office small cellulite. You did great.
Thank you.
Yeah, you're welcome. Looks perfect.